Hi, everyone, and welcome to Effective Multidisciplinary Teams, Strategies for Success. My name is Sarah Florman, and I'm the Trafficking Policy Coordinator at the Sexual Violence Justice Institute, which is a project of the Minnesota Coalition Against Sexual Assault.
And then my name is Hunter Beckstrom. I am the Prevention and Sexual Exploitation Specialist with the Sexual Violence Justice Institute at MNCASA as well. Thank you.
And today we have a couple of panelists from the Sexual Violence Justice Institute who are going to present on a report that our project completed related to working with sexual assault response teams, which are multidisciplinary teams based in communities working on the response to sexual violence. And these are teams that we used as the model when we developed the Safe Harbor Protocol teams. So the work that Hunter and I do with MNCASA is focused on developing local Safe Harbor protocols within multidisciplinary teams in communities across Minnesota. And we completed this report, a national kind of survey of different SART teams and SART leadership across the US and territories, and came up with some information about how best to develop and sustain effective multidisciplinary teams. We're sharing this information with Safe Harbor teams because we feel that it's really useful and relevant to any type of multidisciplinary teaming. And with that, I will hand it over to Madison and Fatima.
All right, hello everyone. My name is Madison Cutler and I'm the Minnesota SART Program Coordinator at the Sexual Violence Justice Institute at MNCASA. So I just wanted to take a few seconds to introduce a little bit about who I am and where I'm coming from. I have been in the sexual assault and anti-violence movement for just over 8 years. I started in 2012 doing advocacy as like a volunteer experience, and it sucked me in. I ended up being a volunteer advocate for close to 6 years. While I was a volunteer advocate, I was finishing up my undergraduate degree, my master's in public health, where I got an emphasis in sexual health, specifically in evaluating sexual health programs. And so that's kind of a little bit about where I come from. Once I graduated, it was really nice. I got to combine both my skills in evaluation and my passion for sexual violence into this really awesome and unique role here at MNCASA. A little bit more about me personally. That lovely four-legged creature there is my pet child, I will call him. His name is Ivan. He's an Australian Shepherd. He's about 4 years old, so he's one of the loves of my life. When I'm not at work, two of my hobbies include exercise. So my undergraduate degree is actually in exercise science and chemistry. And about 3 months out of the year here in Minnesota, I get to ride a motorcycle. So that's just like a little bit about me and where I'm coming from and who you're going to be listening to today.
Okay, hello everyone. My name is Fatima Hayoma. My pronouns are she, her, hers, and I'm the Rural Projects Coordinator here at the Sexual Violence Justice Institute at MNCASA. So my primary role here at SVJI is to provide national technical assistance and training to rural communities working to improve systems response and community response to sexual violence. So I started working at MNCASA in May of 2020. So fairly new still. Prior to joining the organization, I lived in the state of Iowa, where I've been doing mostly direct services and prevention work. So I've been doing work in this movement for about 5 years. A large part of the work I've done the past 5 years has been around prevention education programming in schools and other community spaces. My education background is in social work. I have an undergraduate degree in social work and also gender, women's, and sexuality studies. And I also have my master's in social work from the University of Iowa. So thank you for joining us here today. And just a little fun fact, I am a cat and dog person. These are not my pets in the photos.
Okay, real quickly, we're just going to go over some of the objectives of this training. First and foremost, we really just want to identify the factors that make teaming and teamwork the most successful. Next, we're going to describe successful problem solving strategies that you can use those factors to help overcome and find solutions to. And then lastly, we just want to share some insights and lessons that we've learned from providing technical assistance and just our general work within multidisciplinary teams, and hopefully give you some examples to possibly play around with or expand upon as you see fit. All right, so a little bit about our 10-factor framework for team effectiveness. We started doing interviews in 2015 and into 2016 of 17 different teams. And what we did is we asked these teams a bunch of open-ended questions about what makes your team the most effective in either achieving its goals or achieving its purpose or just having a good impact for victim survivors and the community at large. After a lot of those interviews occurred, we found a consensus that there are about 10 factors that contribute to a team's effectiveness within its community. 6 of them being internal, meaning they are a part of the team itself and how it works. And then 4 of them being external, meaning more about where the team is embedded in and the context in which it's embedded in. So this slide here is just an example of the 10, and you'll see the slide throughout this presentation. But just real quickly, when looking at systems-focused arts or teams in general, we look at these 6 factors, including multi-level leadership, a culture of learning, continuous improvement, emphasis on evaluation and teamwork, shared vision and model, and diverse membership. So those are some of the things that make up a team that we can kind of control, that we talk about those internal factors. The external factors that we're talking about today include the supportive member agencies that are part of the team. You know, what does access to resources and networking look like in that community? What does both community support and community input look like? And then also just the confidence and expertise of the individual SART members. So that's just a little bit about the 10 factors. We're going to spend the next few minutes going into each one of those factors individually. So the first factor we're going to talk about is the internal factor of a shared vision and model. And so what I mean by shared vision and model is that all members should agree upon how the team works. You know, what is the team structure? What is the team's leadership, or who has leadership on the team? And then what is the purpose and the scope of the team's work? So this is a graphic to the right here, just to show an example of 2 different SARTs, or two different teams. We have Team A and Team B. As you can see, their focuses are different. One being community-based and one being looking at individual cases, kind of like an MDT might be. And then next, looking at the structure, looking at leadership and the decision-making processes, you can compare and contrast how different teams can have different models and visions and purposes in doing their work. So an example of a different model that teams might use is a lot of times a team might have a coordinator who is a leader, right? And then all of these team members. But what we've also seen is this idea where we have a team coordinator who is the team leader, but then underneath or working alongside that coordinator might be subcommittee leaders. So if teams get too large, sometimes we can break them down and have, you know, a law enforcement subcommittee, or if you are in an area that has a lot of different schools or educational institutions, you might have like a Title IX subcommittee, or an education subcommittee, or an advocacy subcommittee if you have multiple different culturally specific advocacy organizations. And so we can see that depending on the community, a team's structure and model might look different. When talking about a shared vision, what we're really talking about is the goal, the purpose, and the scope of the team's work, and then what they're intending to impact. And so this is another area that is going to vary depending on what the team is coming together to accomplish. So specifically for this webinar, we can talk about, you know, sexual exploitation. If that's the purpose or the vision of the team, that's going to vary depending on different teaming styles. If you're looking at general sexual assault or sexual assault within domestic violence, you know, just understanding that, or the point of this internal factor is that everyone has a shared understanding of not only the structure of the team, but also the purpose of it. So there are some positive outcomes associated when having a shared model and vision. And so if your team is having any of these conflicts or any of these struggles, it might be important to look at this internal factor. So some of the positive outcomes that are associated with having a shared vision and model include increased role clarity within the team, a reduction of intra-team confusion and conflict, clarity of the purpose, and then that can help improve member and community engagement because you're able to accurately describe, what we're doing and why we're coming together. So that's just a little bit about that internal factor of shared vision and model. So here are some things to think about. If you want to take a second to just pause this webinar, think about, does your team have a mission and vision statement? Some folks do, some are constantly working on adapting it or changing it depending on who's at the table, right? And some folks don't, but it's important to take a second to reflect, do you have a mission and vision statement that guides the team's work? And secondly, what is your team's decision-making process? Do you have a team that it's a majority rules? Do you have a unanimous decision-making where everybody has to agree on something before we move forward? So there's a lot of compromise and discussion. That is something that is important when looking at your team model and your team structure, is how does decision-making happen and how does your structure reflect that?
So the next internal factor we'll be talking about is diverse membership. So there are multiple ways of thinking about diverse membership. Today we'll be talking about 2 ways. The first is multidisciplinary diversity. So what we mean by this is that it is important to look at your team and make sure there is representation that goes beyond the core disciplines that we typically name. So in addition to the core disciplines, you might also look to invite culturally specific programs and organizations, colleges and universities, or other community programs. Who you invite outside of those core disciplines depends on your community. So when you are able to prioritize multidisciplinary diversity and collaboration, you're acknowledging that each discipline, organization, and individual really plays a unique role in the response. And doing so allows each discipline to be able to bring their unique networks, experiences, and knowledge to the team. So it's mutually beneficial for this. The second way to look at diverse membership is looking at the members of the team. So individual diversity is just as important as multidisciplinary collaboration and diversity. Teams should really reflect their communities. So your team should strive for membership whose identities reflect the full spectrum of community members that are being served by the team. So when you're ensuring diversity among team members, you're able to greatly improve a team's ability to remain connected to the community. And also you prioritize your team remaining adaptive and responsive to ever-changing community needs. So some questions to think about when looking at this is your team currently representative of your community, and how do you know? And to quickly summarize the other positive outcomes of this internal framework is that when you focus on this framework, you are gaining buy-in and engagement of all disciplines. You're also increasing in diversity in perspective, experiences, and resources that are available to a team. And you're also decreasing the risk of important issues or gaps in services going unnoticed or unresolved.
The next internal factor we're going to talk about is the idea of multi-level leadership. So really what multi-level leadership looks like is that every member plays a leadership role in some capacity. And what this really helps do is create an equal distribution of power. It also helps acknowledge power imbalances that might occur on teams. And then it also helps to consider all perspectives and knowledge of everybody that's coming to the team. Everybody is a leader and an expert in their own field. And so how can we draw on that leadership and expertise when coming to a team, right? And so an example of what multi-leadership can look like is going back to that example I said earlier about subcommittees. And it's, can we delegate a leadership role to somebody in a way that leads a subcommittee? Or maybe the team has taken on a project of some sort and there's somebody on the team that's really skilled in that project. For example, evaluation. If you're taking on an evaluation project and you have somebody maybe from the school or in academia that's skilled in evaluation, how can we give them a leadership role in that in order to create and encourage buy-in and engagement within the team? So some positive outcomes associated with multi-level leadership, again, giving that power to folks, includes the incorporation of unique perspectives and knowledge of all team members and their relative disciplines, a decreased potential for power imbalances and power hoarding within the team, increased engagement and buy-in from all members, and then support from member agencies and their leadership, which can help improve the implementation of the protocol and other systems change work that the team might be working on. So just some things to think about if you want to pause your webinar again and kind of jot down some ideas. How are power imbalances addressed on the team? Are they just not talked about? Are they talked about, in the parking lot after a team meeting? Are they, or are they out front? Are we very much aware of them and are we able to identify them? The next question is, how is leadership shared amongst teams? And I want you to take a second to just kind of reflect on, what is your team structure and how is leadership shared? And what can you do better to share that leadership amongst team members?
So the next internal factor is culture of learning. So a culture of learning really emphasizes understanding the unique context of every situation. So what we mean by this is it gives us opportunity to track and learn from successes and setbacks. So a question you might ask is, how do you celebrate successes on your team? Or how are issues talked about? An example of this might be starting every meeting by celebrating a team member or agency, or reviewing how you address issues within the team. It also helps us identify emerging strategies and also apply you continuously apply new information and strategies to the team work. So overall, establishing a culture of learning can really improve awareness of positionality and how it affects the experiences of victim survivors. It gives us the flexibility and openness to new ideas and methodologies. So again, continuing that learning and openness to new information. It also gives us the ability to open the team up to new ideas and new perspectives. And I think one of the most important things that come from culture of learning is that it really emphasizes using mistakes as opportunities for learning. So teams can really create an environment in which mistakes and setbacks in a team are really seen as opportunities and places for growth.
The next internal factor we're going to talk about is the continual evaluation and improvement of teams. It just so happens that this internal factor is also closely tied to the 3 phases of systems change that I'm sure many folks have heard about through their work with SVJI. And if you're new to SVJI work or us, you will definitely hear about this again, that's for sure. But what continual evaluation and improvement does is it makes any of the team's outputs, such as protocol or policies, it really makes them living documents that can remain responsive to the needs of the community. And a lot of folks like to ask, why can't we just, write this policy and move on? And the example I always give is the idea of colleges and universities. Colleges and universities tend to be like their own little community in itself. But every 4 years, almost the entire population, except for university staff, completely turns over every 4 to 5 years. And so it's really easy to, see how an app can change, our response. What are we going to do if this new technology advance or this new cultural norm comes in because we have an entirely new population and almost a new generation in itself? The example I give is when I went to college, I didn't know Snapchat. Like that was not a thing. Snapchat was not a thing until I was like a freshman or sophomore. It could have been a thing and I just didn't know. But I didn't hear about it or understand it. And now we can see where, the exchange of, non-consensual images can be part of our response and can change how we respond to things and how it ends up changing laws and just all the things that can kind of spiral out of that. And so it's really important to be continuously evaluating and continuously improving our response. It's also part of what defines a systems change team. It allows the team to determine the effectiveness of their work. It helps to identify unintended impacts, effects, emerging issues, and leaves room for improvement. It also encourages long-term collaboration because there's no finish line. And what we get from that long-term collaboration, is really deep-rooted and trustworthy relationships amongst agencies. If we're able to work well together and be respectful of each other long-term, right? I always like to talk about real quickly some different ways you can evaluate. You can interview responders, you can do group interviews of responders or victim survivors. Commonly, we're doing satisfaction surveys, especially now during COVID when we don't all want to be in rooms together or in close contact. And lastly, you can also do case file review as a way to evaluate and improve upon on the team's work. So positive outcomes associated with continuous evaluation include the evolution of the team's policies and protocols to meet dynamic and evolving needs of communities and survivors, an increased awareness of the newer emerging issues, long-term and more active collaboration between member and member agencies. So next, just some more questions to think about. So if you want to pause again to think through these questions is, how comfortable are you doing with how comfortable are you doing evaluation? Have you done it? Are you a rock star? Could you do it in your sleep? Is it something you are not comfortable with? And so you tend to rely on other folks to help. And then the second question to think about when doing evaluation is what is your capacity? And if you don't have very much capacity to, take on this large evaluation project, how can we make evaluation a more passive and ongoing project so that it's as simple as, a couple questions once a week versus taking months to try to remember and look back and gather information? How can we make it this small thing you do more frequently so that by the time you're ready to look at all the information, it's just there? But how can capacity dictate that decision?
So the next internal and final internal factor that we'll be talking about is emphasis on relationships and teamwork. So this might seem like an obvious one given the definition of a team, but it can be really easy to lose sight of how important relationships and true collaboration is. So earlier we were talking about diverse membership. So although teams are diverse and each member of a team represents their own discipline, agency, with their own perspectives, goals, and interests, when a team comes together, it should really operate as a single collaborative body. So when it's operating as a single collaborative body, there should be honesty and trust between team members. So building trust and honesty involves work, and it's something that is continuously worked on. There should be a value of openness and consistent communication between team members. There should also be a respect for differences. So respect for differences in experience and perspectives, and also active listening. So remembering that the work you're doing is an ongoing process. We're all continually learning and listening and understanding each other. So the positive outcomes of emphasizing relationships and teamwork include improving communication between team members and member agencies. This leads to seamless and effective implementation of protocols. You can also improve relationships between various member agencies and also increase the likelihood of team longevity and success. So some general things to think about during this is, what does trust really mean to you as an individual? How do you gain trust between team members? And how do you gain trust between agencies? So we've talked about the internal factors. And so far we've talked about shared vision and model, multi-level leadership, culture of learning, evaluation and improvement, diverse membership, and emphasis on relationships and teamwork. Now we're going to talk about the 4 external factors. So these are our 4 final factors. We're going to quickly go over confident individual members, supportive member agencies, community support and input, and access to resources and networking. And just as a quick reminder, the difference between the internal and external factors in the frameworks is that the internal factors are parts of the structures and activities and culture of the team itself. And the external factors represent things that member agencies and community members can bring to the team from the outside, so the external. The first of the framework's external factors is confident individual team members. So when an individual is selected to be part of a team or join a team, it helps to come into the role with a strong sense of confidence in themselves and the work they do. So confidence is a constant balance between being confident and humble and open and critical. So some general positive outcomes of this is that when team members have this pre-existing confidence in themselves and their capabilities, they're really able to more effectively represent the team and the work they do and their discipline and organization. They're also able to increase the likelihood that all team members will participate actively and assume leadership roles. And this also allows all members to advocate for the implementation of protocols within their member agencies. So this creates a really good space for honesty and disagreements within teams.
Okay, the next external factor we're going to talk about is supportive member agencies. And what that means is that all member agencies should be active and invested in the teamwork. And so I always like to do is take a second to talk about the team member agency feedback loop. And so, agencies have a team or have a employee or a member that they send to the team. That team does some work, and then it's the expectations of that team member takes the information back to the agency, and then that agency, supports that team member, maybe gives them feedback, and then that member comes back to the team meeting, right? Does more work, brings it back to the agency, and we just have this continuous feedback loop between what's going on at the team meetings, whether they're monthly, every other month, whatever that structure looks like. And the information is going back to the agency, specifically some of those decision makers that might hold the power within those agencies. And so this external factor is really important because those agencies should be actively invested in that teamwork and should, and what that looks like, right, is they implement the changes that the team kind of decides on, and they support that team member in gathering that information, getting that input and bringing it back to the team. Some positive outcomes associated with having supportive member agencies is more consistent implementation of teams' protocols, policies, and best practices. You'll also see an increase in team resources, which we're going to talk about again in a little bit. But this might look like allowing additional time for the teamwork. You'll also see an increase in engagement from member agency employees, including, like I said, agency leaders and the work of the system change or the teamwork. So some things to think about in regards to those factors include, how do you build confidence among team members? Whether you're another team member or a coordinator of a team, or whether you're just here learning about SART work because your agency participates in teamwork, how do you build confidence among those team members so that they see themselves as experts as well? And then secondly, how supportive are the member agencies of your team? Take a second to evaluate, what agencies are really supportive of our teamwork and which ones aren't, and how can we leverage that support to make our team the most effective?
So the next external factor is access to resources and networking. So teams need constant and consistent access to local, state, and national resources and networks for support and training. So what we mean by resources is that it could include training, funding, and space and supplies. And networking might look like community events, so even virtual community events, Conferences. There are a lot of virtual conferences happening right now, and online discussion groups, because there's a lot that you can learn from each other. Some general positive outcomes of having access to resources and networking include that by making sure all members of a team have access to resources, teams can really increase a flow of new ideas and information coming into the team and look into new emerging practices. This can also generally improve relationships between team members and technical assistance providers, other teams, or other community members. And in general, this also provides opportunities for team members to be able to develop new skills with their individual disciplines, as well as the larger scope of the team.
All right, the last external factor, and really the last factor we're going to talk about today, is the external factor of community support and input. So what we mean by this is that teams receive support and involvement from their communities, and then their communities feel invested and engaged in the work of their local SART. And what this does is it improves the team's ability to respond directly to the community itself and what the community identifies as its needs or barriers. I think there's a lot of different ways teams can go about doing that, and we're going to kind of take a second to talk about those in the next slide. But some positive outcomes associated when you do have that community support and input include increased team influence on the awareness of sexual exploitation within your community and the attitudes toward systems-focused work. Sometimes systems-focused work can seem very large and abstract because we're doing these kind of, seems like peripheral activities, but being able to bring awareness to what we're doing and how it influences sexual exploitation for victim survivors is a big benefit of having community support and input. Another positive outcome is an increased awareness of emerging issues, kind of like I talked about, based on the community itself, rather than what we as service providers or responders might think of. An example I like to give about this kind of comes from my public health background, in that one time we received funding to do an intervention to decrease drunk driving amongst teens. And so we went out to a rural place in Minnesota and started, implementing this curriculum amongst teens. And I don't want to say it was a failure, because we definitely learned from something, right? Like, it's not a failure if you learn. But it did, at some degree, kind of feel like a waste of money, because the community was not invested in decreasing drunk driving amongst teens. That was not the issue that the folks taking this intervention felt they needed. What they wanted and what they felt like they needed was proper sex ed. They were not getting that. Teen pregnancy was on a rise in that community, as well as like the spreading of STIs. And so what we ended up doing is just putting a pause to the intervention, connecting that community with the appropriate sources, and then coming back at a later date to do that intervention when the community was ready for it. And so that's just an example of how community support and input can be really beneficial, so that we do have the greatest impact in the good work we're doing, and it's matching up with the community. The last positive outcome associated with having good community support and input include a greater availability of advocacy and other services to victim survivors. So when we're invested in the community, we're much more aware of the services available and the services that we need to be made available for our victim survivors, and what our community has the capacity to hold. So next, just a few more questions to think about when talking about community support and input is, how do you gather community input? Are you, doing community surveys? Is it purely through word of mouth, just from, community events, or doing some outreach maybe? Are you gathering information from the news and news sources? Or are you doing more formalized gatherings, such as group interviews or focus groups? Another option you can gather community input from is also looking at third parties. So for example, according to the Affordable Care Act, hospitals that claim nonprofit tax breaks have to do a community needs assessment every 3 years. And those community needs assessments need to be made public. And then the next 3 years, the community needs to prove that, or the, hospital needs to prove that they put accurate or significant resources into improving those community needs into another community needs assessment. And some of those community needs assessments can be 20 to 60 pages long and have a lot of really good data. And so you can gather that information from third parties as well. Next question is, how do you let the community know what you're doing? Some teams are already really good about doing this by doing outreach events like we talked about, but some other teams might just rely on word of mouth. And again, then who are we bringing to the table? Is it representative of our community? And who is getting our messages and what? Other ways you can do it is doing the, providing information to news sources about what the team is doing, inviting news stations to participate maybe in some of those outreach events and to draw awareness to those. And some folks like to rely on social media. Some teams have their own social media account that they can use to kind of help get the information about what they're doing out. Nice. So that is the end of our 10 factors. And the next part of this webinar, we're going to take some time to look at how we can take those factors that we talked about and put them into action. How can we actually implement changes and continue to do good work based on the knowledge we just kind of talked through, specifically around conflict. So what we're going to talk about first is, how do we define conflict? Conflict doesn't always mean fighting. Sometimes conflict is just the condition in which people's concerns appear to be incompatible. Another way to say this too is concerns are also sometimes just priorities, right? People make their priorities based on what they care more or less about sometimes. And the example I like to give when talking about concerns and priorities is the idea of law enforcement and medical staff. So following a sexual assault or sexual exploitation identification, law enforcement might initially think, okay, we have to worry about community safety, and then, catching the person who caused harm or doing whatever they need to do to keep the community safe. And then they'll take the victim survivor to the hospital and think, healthcare comes second. First, I have to worry about community needs. Where medical staff, on the other hand, think, no, we need to get this person the medical care they need. We need to maybe collect evidence for medical forensics, and then we can worry about community safety, right? Or community needs, like housing or transportation and things like that. In this example, neither profession or neither agency is necessarily wrong, right? They're just trained to think in that way, or their priorities, or they as a person are just passionate about one versus the other. And for the most part, like I said, neither of them are necessarily wrong. It's just a different priority of concerns. There we go. Thank you. This next grid kind of talks about conflict and what are the things that kind of encompass conflict. What does conflict kind of live in, and how do we handle conflict? And this is just a nice little grid to think about two factors that kind of influence how we handle conflict. And one of them is the goal. What is it that we're conflicted about, or what are we having struggles with? And how important is the outcome to me? The next would be, what is the relationship to the person I'm having the conflict with? So going back to that law enforcement and medical exam, or medical personnel, depending on their relationship and depending on what situation they're in, will kind of dictate how they come to a resolution of this conflict. Are they just going to compromise and meet in the middle on everything? Like they each go their own direction and, come to a solution that way? Or is one very passionate about, their their set of priorities or their concerns, and they have very little care about their relationship with the person they're having the conflict with, right? So how do both the goal and the relationship of the person or people you're having a conflict with lead to different conflict styles? And this is just a nice grid you can use in your own work, in your own life. You could use this with your family if you wanted to, like, how close is my relationship with this person? And this is just like a nice little tool that you can come back to over and over again, depending on whatever conflict you might be feeling.
Okay, so this is kind of our frameworks into action portion, but specifically we're looking into navigating conflict. So when looking at decreasing the likelihood of conflict through the frameworks, things that help navigating it include looking at the shared vision and model. So having clarity in this decreases the likelihood of conflict and confusion amongst team members. It also helps look into the multi-level leadership. So this is ensuring that perspectives and knowledge of all team members and disciplines are acknowledged and considered. It also helps to look into the establishment of culture of learning. So the flexibility and openness to new ideas and methodologies also help in navigating or decreasing the likelihood of conflict. And there's also relationships and teamwork, improving communication between team members, member agencies, and creating safe environments between members and member agencies. So when you create these safe environments, there's opportunities for disagreements and concerns to be raised without, endangering the work or overall collaboration of the team. And I skipped this one, but also continual evaluation and improvement, and finding and identifying the unintended effects and emerging issues, and also places where a team can improve in practice or different strategies. So these are just 5 of the frameworks, but these 5 are a great place to start when it comes to decreasing the likelihood or navigating conflict in itself. But really all the frameworks, internal and external, can help. And as a reminder, this is a resource that we have at SVJI and is a resource that is available to you. Okay, so this is I'm quickly going to go over why conflict is feared. So as Madison mentioned, conflict is super common within teams. It's common everywhere, even outside of teams. Conflict is normal. But some general fears, or why people choose to maybe not address conflict, is that there's this fear that the team no longer has a shared vision or model. So the team is, in disagreement. There's a fear that there's, clear power imbalances. So if a team is all about collaboration, there's a fear that there's power imbalances and different power dynamics that exist within the team. There's also fear that growth will slow down or stop. So if there's conflict, then we won't be able to move with protocol that we're wanting. And there's also fear that there's, hostile environment within the team. So like we mentioned, conflict is completely normal. And when you avoid conflict, it's because sometimes people don't want to acknowledge these different dynamics that are happening within the team. But in general, if conflict is acknowledged and addressed, there can be steps taken to resolve that conflict. So on the flip side, we're talking about how conflict is normal. There are also cheers to conflict. So not only fears, but also cheers. There are positives and benefits to conflict and addressing conflict. One is that it could resolve misunderstandings within the team. So maybe the mission no longer aligns with the current setup or members that are part of the team. Well, addressing that conflict could resolve that misunderstanding. It could also work towards improving the processes and also changing behavior. So even though there are negative consequences to conflict, such as reduced group cohesion, lower team productivity, and that it can even threaten a team's existence, it's really important to name the conflict so that steps can be taken to address it within a team. And even though you could work and take steps to avoid conflict, unfortunately, sometimes conflict is totally unavoidable. So like I said, acknowledge or name that conflict. Some tips we have in terms of dealing with conflict include clarifying. So addressing what is the conflict, help members try to figure out what is the conflict that exists. So naming it, affirming the validity of all viewpoints, framing conflict as a problem that can be solved. So that's, putting direction that this is a conflict that exists, but we can solve it through taking these steps. Or you can take a break. So proceed or take a break. Ask a group if this conflict is something that needs to be taken care of right now, or if we can move past it. It's really important to make sure that everyone remains centered in acknowledging or naming the conflict, because that'll help in deciding, the future steps to take.
Okay, the last thing we're gonna do real quick is if you want to take a second to take out a piece of paper or open a Word doc or a Google Doc and just create 3 columns or 3 different categories to create a little action plan. So we've given you a lot of information. We've given you a lot of questions to think about and to take back to your team. But to just wrap it all up in like a nice little bow to keep us moving and the momentum moving is to create like 3 columns or boxes. And in the very first column or box, list the factors that you think you need to work on based on what identifying factors are happening within your team, whether you're struggling with buy-in or you're having conflict on the team, or you're having struggles implementing the team's work at the agency level. Just make a list of factors that you think you need to work on. The second step is to list action steps to work on that internal or external factor, one of the 10 that we listed. So if you need to work on getting supportive member agencies, how are you going to do that? What action steps do you need to take in order to increase confidence in your team members or increase your diversity on your team? And then lastly, looking at a date and deadline for completing this action. This is just kind of to hold yourself accountable. You can feel free to share this, with your supervisor or other folks doing teamwork that might be able to help you just check in every once in a while. But being able to just take a few minutes to write down some action steps moving forward out of this training can really go a long way sometimes. All right. So if you have any questions at all, feel free to contact us. Our information is there on the next slide. And I will hand it back over to Sarah to close us out. Thank you.
Thank you, Madison and Fatima. So yeah, to wrap up, because this is a recorded webinar, I'm certain that many of you have a lot of questions. You can find the frameworks report on the MNCASA website at mncasa.org. Otherwise, you can email any of us. We will share out this recording and share out that report and would be happy to talk more with you about how these different factors your team and kind of the areas that resonated this most strongly with all of you. So thanks for watching and shoot us an email if you have any questions. Thanks.